evening, everyone. My name is Dr. Vyas. I am the Vice President of Medical Services at RED.Health. And it is my proud privilege to welcome you to this edition of Health Talks by RED.Health. And we are focusing on the heart. On the occasion of World Heart Day, RED.Health continues to see a lot of people calling in to us asking for help when they are suffering from chest pain, which can often be a life-threatening heart attack. In this situation, RED.Health always tries to get them to the nearest best hospital where they can get care from the best cardiologist available in town. But that is all that we can do. What you can do is to protect yourself by knowing when to expect something like this is going to happen, and also knowing what to do in a situation when this happens. At RED.Health, our endeavor is to bring you the best specialists when it comes to health so that you get the best advice. And in line with that, today in our studio, we have Dr. Kashyap Vyas. Dr. Kashyap Vyas is an interventional cardiologist who practices at Yashoda Hospitals Hyderabad. He's a very popular, well-known, well-spoken. His patients love him, and he works in a very, very busy interventional center which does nearly 180 to 200 angioplasties a month. And that's not even talking about the number of angiograms that they do. So he is the right person today to tell us what we have to do when we are faced with the dire situation of chest pain, and when we are worried what's going to happen to our loved one. How soon should we get to the hospital? When we get to the hospital, how are doctors able to help us? And on the way to the hospital, what precautions must we take? To ask all these questions, I welcome Dr. Kashyap Vyas to the show. Thank you, sir.
Thank you for having me, sir, over here. It's a great honor to be here in a new startup which I've been recently awarded as one of the healthcare startups of Telangana by T-Hub. So thank you for having me.
Thank you so much for being kind to us, sir.
Yes.
I have a lot of questions in my mind that I want to ask you, okay? But I want to ask you one burning question. We know that heart attack is the number one killer in India right now. 50% of deaths in our country are happening because of heart attack. So Dr. Vyas, let's start from the very basic, okay? When somebody has chest pain, what does it really mean and how seriously should they take it?
See, sir, chest pain has many types. Chest pain might be a pain in the retrosternal area, and sometimes the pain will be of different types. It can be of squeezing type, heaviness, tightness, and it can be radiating towards the left shoulder, towards the right shoulders, towards the back. And any pain, if the patient is having comorbidities like sugar, hypertension, and any pain radiating from jaw to the umbilical region, should be first considered as an heart attack. They should immediately rush towards the hospital, take a ECG, and if everything is all right, they can go back.
Right. Okay, so they should rush to a hospital is the first advice you're giving. Matlab, not to take any chest pain lightly.
Yes.
A chest pain can be because of many reasons, but the most dangerous reason is a heart attack. So let's not take a chance. We have to reach the hospital.
Yes.
Now, the common tendency among people is when they have a chest pain, they first say, they call their family member and they say, chalo, gadi nikalo, let's go. Is this a good thing or a bad thing?
No, sir. I think in India, a lot of chest pain has been taken up as stomach pain, because chest pain will be a retrosternal area where most of the people think it is more of an stomach pain. So people in India have a tendency not to visit hospital due to various reasons, due to financial reasons, due to inconvenience. So in this kind of patient, a lot of patients in this scenario will land up into more severe kind of heart attack, where has it come in a delayed or a late presentation. This will result in increase in the mortality.
Right. So what you're saying is most people when they have chest pain, they don't think that it is something that's happening in the chest or behind your central bone,
Correct.
that is a sternum, but they are thinking it's something to do with the stomach, maybe gas.
Yes.
Which is what Indians always say, gas ho gaya, isi ki wajah se dard ho raha hai,
Yes.
right? So they think that's that and they tend to ignore it.
Ignore the pain.
Sometimes this becomes life-threatening.
Yes.
And it is too late for them to reach the
Yes.
hospital, right?
Or even if they reach, the presentation will be delayed. So even if we recover and even if we do angiography or angioplasty, the chances of recovering the full heart function will be on a minimal basis.
So you're saying, so explain to us why chest pain leads to poor recovery. Matlab, what happens in a heart attack? Can you tell people what happens in a heart attack? Why is the heart muscle affected?
See, if you take in on a very layman basics, generally heart is supplied by three main vessels. known as coronary vessel, और जिसको अपन heart के vessels बोलते हैं. In that vessel, if any of the vessel is blocked, that will result in muscle death. And as the time progresses, the muscle death increases in that specific area. So in that case, you have to rush to the hospital more immediately. And if you don't reach on time, the death of the muscle will increases in the other part of the heart. That will result in more severe condition like cardiogenic shock, heart failure and all. Like we have seen in Bollywood movies also, when the doctor receives the patient and he said that if you would have come more 30 minutes or 15 minutes faster, then we could have saved the life. So this is an example of this one, sir.
Excellent answer. I think a lot of Indians can associate with that, where we've seen a lot of movies. इसमें तो होता ही है, काश इनको आप 5 मिनट 10 मिनट फैला दे, 15 मिनट फैला लाते तो शायद हम बचा सकते. So doctor is explaining के how that helps,
Yes.
right? जितना देर उसको blood supply नहीं मिलेगा, that much heart muscle will die.
This, exactly,
Right?
sir.
And we can reduce this.
Yes.
Correct? And once it dies, there's no recovery, Dr. Vyas?
No, in few cases there might be recovery, but in generally the more the delay the presentation, the less chances of it.
Fantastic. So again, this is highlighting why it is important when somebody has a chest pain, they have to reach the hospital as early as possible. Excellent. Now, can somebody recognize कि chest pain हो रहा है, अब ये हार्ट की वजह से हो रहा है, नहीं इसको मैं इग्नोर कर सकता हूँ, ऐसा कुछ है जिससे पता चले कि this is only because of the heart that I'm getting this chest pain?
If anyone is having any doubt, sir, it's always better to come to the hospital, take an ECG, wait for half an hour, redo the ECG and then go home. Because sometimes even abdominal pain or stomach pain can lead up to cardiac conditions.
That is unfortunate. Yes, so that is why I think every chest pain should be taken seriously
Yes.
until proven otherwise.
Yes,
Correct?
Exactly, sir.
Excellent. Brilliant. Thank you, Dr. Vyas. Now, I have more questions now. अब तो define हो गया कि भाई heart attack होता है, जितना जल्दी पहुंचते हैं that is better, and chest pain is का signaling mechanism.
Yes, sir.
Right?
Even only not chest pain, even if patient is having giddiness or syncopal attack, जिसमें बेहोश हो जाते हैं लोग, कुछ थकान हो जाती है थोड़ा चलने से, and if there is breathlessness while walking, that also is a sign of cardiac manifestation, sir.
Excellent, excellent. So please be aware of these conditions that Dr. Vyas is explaining to you. But I have a more important question.
Yes.
Dr. Vyas, when somebody has chest pain and they decide I have to go to the hospital, do you prefer that they come in their own vehicle or do you prefer that they call an ambulance?
The best way to come to the hospital when the patient is having chest pain, if your hospital is within your radius, like approximately 2 or 4 kilometers or 5 kilometers, and if there is someone to drive, then it's better you can take the help of the person nearby you and you can come to the hospital. If in case the chest pain is severe and the patient is not stable and no one else is to drive, it's better to call the ambulance services to the nearest part and you can go to the hospital.
Excellent, excellent. So, आपको लगता है अगर chest pain है but stable है and hospital तक पहुंच जा सकते हैं and they will do that before an ambulance comes and picks them up, then okay.
Yes.
But उनको नहीं चलाना है. They shouldn't be driving, right? Why are you worried? What happens if somebody with chest pain decides कि मैं drive करूँगा खुद ही? आप लोग मत
If
परेशान
the
हो.
patient is having chest pain, sometimes what will happen, the blood pressure will suddenly fall down and he might land up into giddiness or syncope that will result in unfortunate accidents also. So it is always advisable to have someone nearby who is driving, or you better, if you no one is there, an elderly patient, it's better you call an ambulance.
Yes, recently we saw a video also where there was a bus driver who was driving a passenger bus on a highway
Okay.
and they were on a bridge. Unfortunately, he had a heart attack when he was driving and the bus tumbled down from the bridge. Unfortunately, that's
Unfortunate
it.
incident.
Yes.
That is what I am trying to.
Yes. And so that I think is very valid point.
Yes.
अपने लोग जो होते हैं हीरो बनते हैं, बोलते हैं कि भाई नहीं चेस्ट पेन है मैं देख लूंगा कोई नहीं, because we are used to being the man of the house.
Correct, sir.
We're used to being the stars कि हर problem को we can handle it ourselves.
Yes.
तो we say नहीं हम खुद ही चले जाएंगे, right? This is what we have to be careful about.
So I just wanted to ask you a question, sir. In your ambulance services, what is the approximate time you take to reach your target place and come back to the nearest hospital?
Our targeted time is less than 15 minutes. Less than 15 minutes. And if you even test now, we give a lot of importance to this. अगर आप अभी भी call dial करेंगे, 911 dial कर लेंगे, we will answer your call within 5 seconds. Within 5 seconds, your call will get answered. Even if you try right now, that will be there. And we try to get the earliest vehicle out there and bring them to the nearest possible best hospital.
And sir, in your cases, with the ambulance, is there any doctor or trained nurse to handle the situation like heart attack, or they're able to read ECGs, or able to manage the situation over there?
We do have trained EMTs, emergency medical technicians we call them.
Okay.
इनकी ट्रेनिंग होती है. This is their part of the job where they are supposed to be able to handle emergency situations.
Okay.
But we also have certain ambulances where we take a hospital support. In that case, तो hospital भी इसमें involve हो जाता है कि आपका call आया, आप nearest hospital हो, तो they can also decide कि उनके साथ उसमें डॉक्टर भी भेजना है कि नहीं भेजना है. So we leave that call to the hospital that is nearest to the patient. If we can provide that, that is better. Then the hospital decides कि जाएंगे. But otherwise, from ourselves, we try and send an emergency medical technician who's trained in saving lives. This is what we do.
We're discussing is, if an ambulance come to your home, and if there is no ambulance or you're not able to assist any transportation to come to hospital, the next important thing is the patient, if he lies down suddenly with loss of consciousness and is not able to respond, there is something called as CPR. CPR is very important and very vital in saving the person's life.
Absolutely.
And I was very fortunate that RED.Health people have a complete separate video to show us how to do a CPR in both young people, adults, and as well as infants and pediatric age.
That is correct, sir. So Dr. Vyas rightly said that if it is taking time to reach the hospital and you're still at home and somebody suddenly faints, बेहोश हो जाते हैं, then you should know how to do CPR. और इसको हम बोलते हैं basic life support. We will give you a link on how to learn to do basic life support, and if you're interested to learn from RED.Health, we will also teach you. But basic life support कोई भी कर सकता है, right, sir?
Definitely, sir.
Anybody can do, and it's not necessary कि medical person को ही करना है. Even school children in Japan are taught how to do CPR. ये बाकायदा उनके training में होता है. So let's move on. So ठीक है sir, let's hope that somebody has found an ambulance. और वो ambulance में they are coming to the hospital. Why do you feel more secure when somebody with chest pain is coming in the ambulance rather than coming in their own car? What is the difference you feel?
So, heart attack itself possesses great other risks apart from coronary artery blockage. Like there might be rhythm disturbances that will immediately require defibrillator.
Mm-hmm.
So for that cases, it's important that the patient coming in ambulance, and if he has ventricular tachycardia or ventricular fibrillation, and on timely if we are able to defib him, then that is the best part. We can save a life.
Excellent. Now, to explain it to my non-medical friends, heart normally beats lubbed up. ऐसा
Yes.
खुल के बंद होता है, right? Lubbed up. And suddenly when we say ventricular fibrillation starts dancing. इसको हम colloquially बोलते हैं dancing heart. Dancing heart. तो इसमें हम फिर shock देते हैं. जैसे एक बच्चा इधर उधर खेल रहा है क्लास में, तो टीचर एक मार लगाती है, बोलते हैं भाई बैठ जा, पढ़ ले.
Excellent.
Exactly, right? So that is a defibrillator. Right. और कार्डियक अरेस्ट में मैंने सुना है कि एटलीस्ट 50% में ऐसा डांसिंग हार्ट होता है. ये सही है सर?
We can't say kitne percentage, we can't predict how many percentage is there, but not all cardiac arrests are shockable. That also is important to learn. See, that has a very basic science approach and how to approach cardiac arrest. That itself is a big generic topic that should be taught in from school life only. How to recognize whether to give shock to the patient or not.
Not give it.
When to give, when not to give.
Say, right.
So all this should be taught from basic medicine.
Right. And many international countries have this rule. If at least 1,000 people are there coming to one place,
Yes.
they should have this shock-giving device, which even lay people can use.
Yes, as you can know, the famous footballer Eriksson had a cardiac arrest.
Yes.
And he was immediately saved with defibrillator.
Yes, this was during Euro 2020.
Correct.
I was watching the match. मेरे सामने I saw him just go blank like this, and he fell down.
Yes.
And he's one of the best footballers in the world, right?
Yes.
Christian Eriksen.
One of the best footballers.
Denmark, right? But we are glad that he got saved.
Yes.
It was amazing, fantastic. And Denmark, I think, then progressed to the next round also.
Yes, they progressed.
Kudos, hats off to them.
Yes.
Right. But the point here that we're trying to make is CPR malum hona and having the right device at the right time makes a big difference.
Yes.
And this is how coming in an ambulance can save lives.
Yes.
In case, God forbid, something bad happens. Yes. All right. In your practice, can you tell us how many people generally come to the emergency department or to the hospital in an ambulance?
In my hospital, sir, there are generally 2 or 3 every 24 hours.
Okay. That's quite a bit.
Yeah, it's quite a bit. And even in OPD basis, like in mornings in 7 o'clock, they are having chest pain. They come at 9 o'clock in a normal OPD basis. They also land up in acute MIs.
My God. तो आपको मतलब कैसा लगता है कि आप ओपी पे बैठो? मतलब इमरजेंसी तो हम पहचानते हैं, मतलब डॉक्टर्स होते हैं, देयर ऑल एवरीथिंग फास्ट ट्रैकिंग एवरीथिंग, चलो टेक देम सेंड देम टू दी वो मतलब कैथ लैब वगैरह कर रहे हैं. बट ओपीडी में आप बैठे हैं, यू आर नॉट एक्सपेक्टिंग के ये जो बंदा इज स्लोली वॉकिंग एंड सिटिंग इन माय चेयर इज गोइंग टू बी हैविंग अ हार्ट अटैक, राइट?
Recently,
कैसा फील होता है?
recently I had a very great example, not to say great as an adjective, but a 20 years old patient came to me with normal abdominal pain. He went to another hospital where they just have given an abdominal pain, like stomach painkiller injection, pantoprazole, and they said 20 years patient will never have an heart attack. So fortunately, he came to me in the OPD basis. When I have seen the ECG, it was acute MI, and timely intervention was done. It was 99% blockage in the main vessel, and his life was saved. Otherwise, more 30 minutes and he would have collapsed on 30 minutes.
This is very, I mean, I don't know whether to call it interesting or scary. समझ नहीं आ रहा. Because first and foremost is the fact that he came in walking.
Yeah.
Second fact is that वो 20 years old है.
That's the reason, sir. You should not ignore any pain. That any pain from jaw to umbilical should be first taken care of. They should first be going to the hospital, taking in basic ECG. It's not that expensive, sir, ECG nowadays. It's hardly cost from 100 to 300 rupees. If 300 at the highest center and 100 rupees at the lowest center. But you'll be able to save a life.
Mm-hmm. And nowadays ambulances also have the facility to do ECG in the ambulance itself. Or through the phone, they're easily transferring to the doctor.
Yes.
Hospitals are already ready. Cardiologist को पता चल जाता है, cardiologist भी ready हो जाते हैं.
Ready हो जाते हैं.
So everything gets fast tracked.
Fast. As you said correctly, sir, the faster the patient comes to the table of cath lab and the faster we are able to keep a balloon and open up the vessel, the more chances that the patient's life will be saved and more chances the heart muscle death will be less.
Excellent. All right. So, yeah, that's what I was saying. So, all of you have to remember the points that Dr. Vyas is making, not only about chest pain itself, but also how to get there on time, how to give CPR or basic life support on time, how it can save a life. Live examples हमने टीवी पे देखे, इंटरनेशनल स्टार्स के साथ हुआ है.
Yes.
और एम्बुलेंस में कैसे डिफिब्रिलेटर मिल जाएगा आपको, ECG रिकॉर्डिंग हो जाएगी, फास्ट ट्रैक हो जाएंगे, राइट? बट ऑल ऑफ दिस स्टिल we have to find out, why are people getting so many heart attacks? आपने बोला 20-year-old.
Yes.
Why should younger people be getting heart attacks? क्यों हो रहा है ये?
There are many multifactorial, like the dietary habit, excessive smoking, excessive alcoholism, more into social media. आजकल everyone spend more time, more than 5 or 6 hours on screen time on mobile phone, less outdoor activities. This all together can lead up to multifactorial that will result in cardiac manifestation like heart attack, even increase in lipid, hypertension, diabetes, and all this causes the problem called as heart attack.
So multifactorial problem है यार, एक चीज को हम point out नहीं कर सकते. So a lot of younger people are also beginning to get. So it's a warning sign for us to lead healthier life.
Yes, exactly.
Excellent. Okay, let's say we saved a person from having some bad event by transferring them in an ambulance to the emergency department, right? But still, बहुत सारे लोग डरते हैं angiogram से. They have to be convinced a lot. Chest pain है, cardiologist comes, angio करना है. नहीं, doctor साहब. Do you face situations like that?
Yeah, we have faced a lot of situations like that. But the mortality rate of angiogram is 1 in 11,400 patients. That is 0.04%.
Right. So there is
nothing to worry about angiogram. It is very safe procedure. There is very little complication or no complications at all. The unnecessary hype regarding angiogram and there will be a serious problem and all, this is all old age practice.
Myths which don't hold any water. Yes, right?
Yes.
So angiogram is a very safe procedure. And a lot of people think angiogram करना है तो angioplasty करना ही पड़ेगा. आप बताएं sir, how many angiograms are you doing in a month in your center?
In our center, we are doing almost around 600 to 650 angiograms. Out of that, around 180 to 200 people will require stenting, that is known as angioplasty.
That is only 1/3.
Yes.
So, yani ki 65% are going without any stenting.
Yes. And there is a bad myth regarding that if you do angiogram, doctors are keeping stent for no cause. But that is not true because everything is now become computerized. Now even the stenosis is measured through computer, and if it is above 70% only, we are trying to keep stent. Otherwise, we are not.
Correct. And anyway, as far as I know, as a cardiologist, आप angiogram करने के बाद उनके family को बुला के दिखाते हैं.
Definitely, sir.
दिखाते हैं. And it's a recorded
thing.
ऐसे नहीं कि आप secretly कुछ कर रहे हो.
नहीं, it's a very open.
Exactly. Angiogram करते हो, दिखाते हो, उनको choice देते हो. करना है कि नहीं करना है. It's very, very straightforward procedure. So no need for anybody to worry about such things.
Definitely.
So they have to remove this myth.
Yes.
And the important thing we have to stress on them कि भाई आप जल्दी करके पहुंच गए हॉस्पिटल, जितना जल्दी आप एंजियोग्राम करोगे उतना बचा सकते हैं.
This is a sad truth, sir, in India. If the patient comes with acute MI also in emergency department, they will first take a confirmation from their relative, then through their secondary doctors.
Right.
Then they'll go into the financial action. Then they will be ready for the procedure.
Correct.
So, Wahabari, you will waste around 30 minutes to 1 hour.
Which can be very, it's a huge loss for the muscle.
Yes.
Wait कर रहा है, बहुत प्यासा हो गया. He's like, यार, please give me some blood,
Yes.
right? And you're like denying that blood to this person. And so this is a very, I have seen this in the emergency also. मतलब पहले जाते हैं, डॉक्टर देखता है, अरे भाई आपको MI हो गया, let's do an angio, cardiologist तैयार है, cath lab तैयार है. They'll say, no doctor साहब, wait. हम अब पहले अपने रिलेटिव से पूछेंगे, हमारे घर के जो जिम्मेदार है वो आएंगे, दे विल कम एंड मेक अ डिसीजन.
Correct.
वंस दे मेक अ डिसीजन आपको और एक डॉक्टर से भी पूछना होता है.
True.
एंड देन यू से अच्छा आप कितना चार्ज करेंगे, अच्छा विल सी वेयर, वहाँ पे वो कितना चार्ज करते हैं. सो ऑल ऑफ दिस हैपेंस. इट्स ऑलमोस्ट लाइक यू बाइंग अ प्रोडक्ट. यू आर नॉट रियलाइजिंग कि आप अपने हार्ट को बचाने की कोशिश कर.
That is an unfortunate and sad truth in India.
Unfortunate. Let's hope people with this conversation get out of that mindset, right?
Definitely.
So really thank you for sharing that information with us. So let's not only talk about कि भाई कैसे आप हार्ट अटैक होने के बाद अपने आप को बचा सकते हो. Let's also talk about how to prevent this from happening.
Yes, it's a very good question, sir. How to prevent heart attack from young age to the elderly age. As we say, sir, we have to be a very strict person. We have to be a very disciplined person to avoid an heart attack or to do any progress in any field, sir.
Mm-hmm.
Now, as you say that how to prevent it, you have to regularly walk.
Okay. Just walk.
Just walk.
ऐसा भागने वागने, not necessarily. Just walk every day.
People are too lazy even to walk, sir. Now they are wearing smart watches, they are counting steps. So some people are telling it is 5,000, 7,500 steps, some are telling 10,000 steps. But at least you walk 5,000 steps, that is more than sufficient.
Excellent.
And the dietary habits, sir.
Okay. No, I was going to say, I have heard somewhere that if you walk 4,000 steps a day, your lifespan will increase by 4 years. This is data, evidence, मतलब scientific research किया गया है. And they have done this on about 1 lakh people. 1 lakh people data में they have found if you walk 4,000 steps a day, your lifespan can be increased by 4 years.
That I am not aware of, sir. I have not read that paper. I think I'll take a research on
There is in preventive health, there is a lot of work, sir.
That is good, sir.
I think it's very boosting for what you just said.
Yes.
Right.
So as you say, sir, normal walking is sufficient for most of the patient to prevent heart attack. You can't prevent it like forever, but at least you can delay it.
Delay it, yes.
And if you keep on walking, there is something called as natural bypass. So from the artery itself, there will be a lot of subtle branches that will help in...
oh, amazing. So heart itself will create smaller new
branches that will help in supplying other parts of the muscle.
Very nice. And it will support the main branches.
Yes.
So all load does not have to be carried by the main branch.
That is known as natural bypass. That is seen if you keep on walking regularly, it will itself grow.
Excellent. You're learning new terms to dancing heart सीख लिया, natural bypass सीख लिया. और इसके लिए सिर्फ walking करना है भाई. आप लोग सब walking करो यार. Even when you're watching this video, start walking please. All right. तो और walking के साथ आप diet के बारे में बोल रहे थे sir.
Yeah, diet itself, like, sir, a lot of people today are having, because of time constraint and all, they are keep on having refrigerator food and others outside food. They are almost having Swiggy, Zomato.
Of course, yes.
They are more profitable than hospital organization has of no.
Right, unfortunately, yes.
So outside food should be avoided. At least weekly, once or twice is okay. Yeah. And colored wrapped foods, like anything you see in color, like red, yellow, blue, like chips, chocolates, biscuits, it's better you try to avoid. Weekly once or twice or in a party, it's okay, but not on a daily basis.
Excellent, right. But Hyderabad is a very strong eating out culture, sir.
Yes.
Hyderabad का culture तो आप बदला नहीं सकते, but personal culture बदला सकते. Right. So I think there is no control on what is going into the food that is being cooked outside.
Yes.
At least आपके घर में you have control as to what's going there, and you can decide what's coming into your body.
Yes.
I very agree with you.
Even to avoid more preventive health checkup is also very important. We have to regularly check our BP, no matter what's the age. From any age, you have to regularly check your BP. You have to regularly do blood investigation at least once a year till your age of 45. You have to do regularly lipid profile, sugar profile, and other investigations.
तो शुगर, कोलेस्ट्रॉल एंड ब्लड प्रेशर, ये 3 चीज को मेनली कंट्रोल करना है.
Mainly control करना है सर. And even other parameters होता है सर. जैसे now blood test in India is very simple. It's very cheaper also through many different organizations and lot of camps by big hospitals. Even you are doing a lot of camping regarding the preventive care and all.
Yes, we are
So
working.
that will help in.
Excellent, excellent. So yes, that is our goal. That is one of the reasons why we are having this is prevention only, so that you can become aware of what are the steps you can take to prevent a mishap from happening.
Yes.
Right? Excellent. Thank you. Now tell us about. कोई लोग बोलते हैं कि आपके ब्लड, कोलेस्ट्रॉल सब नॉर्मल हो सकता है, बट अगर आपके फैमिली में हिस्ट्री है.
Yes, sir. Family, yeah, as you rightly say, family and genetic factors also play a lot of importance in patient having heart attack, sugar, BP, and or different, जैसे thyroid हो गया. Even cancer tendency is also
Higher.
there in genetic.
अच्छा, right. So if we have a family history of heart attack, we should be extra cautious,
Yes, sir.
more careful for
In India, किसी ना किसी family member को heart attack आ चुका है. India में, हर family में से.
correct.
So we should think that we are people of cardiac.
Very high cardiac risk
High
people
cardiac risk.
because अगर 50% अपना डेथ रेट हार्ट अटैक से है,
तो almost हर घर में एक
it's like that
patient.
toss of a coin हो गया 1 to 1 1 is to
Exactly,
2.
sir.
Excellent. You know, this has been a great conversation.
Thank you.
आपने इतने सारा information share किया and in a very easy to understand manner.
Mhm.
But this is one World Heart Day.
Yes.
This has to continue for the rest of the year.
Yeah.
So that next year when we come back together again, we have more good news to tell people,
Yes.
right?
Yes.
So on the occasion of World Heart Day, अगर आपको लोगों को बोलना है कि भाई ये सब चीज़ें आप करो as an initiative and you will make me very proud, what is it that you would like to tell people?
As sir was suggesting, that at least 4,000 steps should be walked by every person, especially those who are at higher risk. Means in India, everyone is at higher risk because of pollution, because of other dietary habit, and because of family history. So it's always advisable to at least basic minimum of 4,000 steps, followed by dietary advice. Jitna ho sake, you have to have home cooked meals, avoid going out, cut down on alcohol, completely avoid smoking, or cut down on smoking, those who are habitual to it. And next thing, if the patient, any patient who is complaining of jaw pain to till umbilical pain, it is always advisable to take an expert opinion of any doctor, let it be an MBBS doctor or a medicine or a cardiologist, or in fact any other specialty also. Just take a small ECG. ECG ke baad you can take an advice. And if everything goes well, you can go ahead for angiogram. Like all previously myth, like angiogram is a very serious procedure and it has lot of risk. It is all myths. It hardly, as I said you, it is from 1 in 11,400 patients. So it is barely 0.04% or 0.01.
Absolutely. And it is the gold standard, isn't it?
Yeah,
Angiogram
is the gold standard. As you said, CT coronary angiogram is also a new procedure, that a new thing that has come into the play.
Yes.
But there are a lot of
Pros and cons.
Higher
radiation है. और इनफैक्ट अगर CT कोरोनरी में कुछ है तो फिर से आपको तो एंजियोग्राम करना ही
Exactly.
right?
And it's better to avoid CT coronary angiogram for patient above age of 55 because there is something called as calcium score, sir. If calcium score is higher, the lumen area would not be able to
visualize the CT angio.
Visualize much better.
So higher calcium score matlab CT angio may not be useful for us.
So it is advisable to go for conventional angiogram also.
Excellent.
And to stress more, if the patient is having chest pain or any other setup, if you are finding a patient with chest pain or patient had a lie down or a syncope or loss of consciousness, it's better that you immediately rush to the hospital, or if you are not able to manage, you immediately call off ambulance services. I think, sir, as a RED.Health people are doing a very good job.
Thank you.
Only in 10 to 15 minutes, what I came to know, in urban areas and in semi-urban areas, they are affiliated to other smaller hospitals where they can immediately book an ambulance for you and come to the nearest hospital. And also regarding to learn about the CPR, to understand regarding the CPR and basic life support, I think they have a lot of in-depth knowledge regarding it since they are into the emergency services. So based on the videos, you can learn, and even you can teach your children regarding it from the age of 7 or 8. The children can learn regarding it, how to give CPR, when to call an ambulance, and other things that can save their parents' life and as well as others.
Absolutely. That is our goal as well, sir. Thank you for bringing that up. We also try to teach people basic life support, how to do CPR, so that in every house, there is a lifesaver.
Lifesaver.
That is our goal. Well, today on our show, we had Dr. Kashyap Vyas as our lifesaver. He's given you a lot of life-saving tips, and not just for when the chest pain happens. You should always start from before the chest pain happens. So ensure that you're, doing your preventive measures very well every single day, because we want to see you again next year, very healthy, listening to our next health talk with Dr. Vyas and fulfilling his dream of seeing a healthy you.
Healthy heart.
A healthy you with a healthy heart. There you go. All right. Thank you, Dr. Kashyap Vyas. It's been a pleasure talking to you, sir. This is Dr. Tausif Tangalwadi from RED.Health signing off, wishing you a wonderful year and a wonderful heart on World Heart Day.